already some idea about the different compartments of the leg. We see there are 3 compartments. One, the anterior compartment, lateral compartment, and the posterior compartment of the leg. This is the leg and this is the cross section, and in this cross section we can see most outside this layer is the skin. The red one is the skin. Okay. Below the skin, this space is the superficial fascia. Okay. And the green one is the deep fascia. And in the leg, the deep fascia is called fascia cruris. In the thigh, the deep fascia is called fascia. Can anybody tell me? The deep fascia in the thigh, it is called the deep fascia in the thigh is called as fascia. Yes, very good. Fascia lata. Similarly, deep fascia in the leg, it is called fascia cruris. Deep fascia in the leg, it is called fascia cruris. He will tell you about the different names of deep fascia at different places of the body. Now, I am asking the deep fascia of the thigh.
Fascia lata.
Fascia lata. Fascia. Fascia, I have seen in the mobile, the fascia. The fascia, I have seen it, fascia in the fascia. Fascia. First, fascia. What it is called? Fascia or fascia? The layer is called fascia or fascia. The first mistake is fascia. Now, the fascia in the leg, in the thigh is called
fascia in the thigh is called
তুমি এসো বা ওই যে চশমা What is the name of the deep fascia in leg? The deep fascia in leg is called fascia lata. Your friend will give you the answer, no, in your examination. Then why you are talking there? No use. In the examination, there will be so many video cameras. and it will be connected with the university. There will be an observer. Nobody will help you.
Yes, sir.
Self-help is the best help from now onwards. Don't waste time, please. Okay? So the deep fascia in leg is called the fascia cruris. Cruris means, crus means limb or leg. Crus. So we can find, hello, a battery, দেখো তো, hello, 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 না না না, হবে না, leave it. এখন আর কিছু করার নেই. So the deep fascia we can find here, the green one is the deep fascia, and from the we can also see the deepermost, in the deepermost layer, this medially we can find tibia and laterally we can find, this is the fibula. From the tibia and fibula we can see that the attachment of the deep fascia, okay, it starts from the anterior border, okay, of the tibia. Now it's round the leg and it ends here. That means at the posterior border. Now, so, and from the fibula we can get two septum, one in front, one behind. They are called intermuscular septum. One is anterior intermuscular septum, one is posterior intermuscular septum. So, see, this deep fascia forms a, as a whole it forms a compartment, single compartment of the leg, which is being divided by this septum and this septum, and we can get one compartment here, one compartment here, and one compartment behind. This compartment which is present anteriorly, it is called anterior compartment, which is present laterally, that is the lateral compartment, and which is present posteriorly, that is the posterior compartment. The anterior compartment it is here, and the muscles of this anterior compartment helps in extension of the foot. So these anterior compartment muscles are called the extensor muscles, whereas the posterior compartment muscles causes flexion. So it is called the flexor compartment. Similarly, in the lateral compartment there are only two muscles which causes, suppose this is, just imagine this is the foot, it is resting over the ground, okay. This is the medial border, this is the lateral border. There are some muscle which causes elevation of the medial border, and there are some muscles which causes elevation of the lateral border. Elevation of the medial border is called inversion. Inversion. Whereas elevation of the lateral border is called eversion. So continuously inversion and eversion, when we are walking over a rough surface, there is continuously inversion and eversion. So there are some muscles which causes inversion and there are some muscles which cause the eversion. These lateral compartment muscles, they are peroneus longus and peroneus brevis, and peroneus, actually peroneus tarsus is unfortunately it is present in the anterior compartment, but their function is eversion. Whereas the muscles of the anterior compartment like tibialis anterior, they causes the elevation of the medial border. So they are the inverters. Inversion, eversion. So in the lateral compartment, though it is a small compartment, here we get two muscular compartment, muscles, and in the posterior compartment, which is been again divided by this transverse fascia. Okay, there are two transverse fascia, one is superficial and one is deep, which creates, again subdivides the posterior compartment into 1, 2 and 3 sub compartments. So that one is not our today's discussion. We are limited with the anterior and lateral compartment. We have already seen the muscles. What is the dorsum? Which one is the dorsum? That is the extensor surface, okay, of the foot. It is the dorsum. Whereas the flexor compartment surface is called the plantar surface. So this is dorsum, and we know all the anterior compartment muscles are continued to the foot, whether the flexor group of muscles or extensor group of muscle, okay, they are continued towards the foot. The extensor group of muscles, they are continued to and we are visible at the dorsum of the foot. Like tibialis anterior, like extensor digitorum, extensor hallucis longus, extensor digitorum longus, peroneus tarsus, peroneus longus and brevis we have seen, we will see. But these muscles are muscular in the leg, but they are continued as tendon in the dorsum of the foot. Now in the dorsum of the foot, when we dissect, when we cut the dorsum of the foot, immediately we can see one venous in the subcutaneous tissue. We can see a venous arch which is called the dorsal venous arch. The dorsal venous arch we have also seen in our dorsum of the hand. Similarly, in the dorsum of the foot we can also see a dorsal venous arch. And basically it is formed by, we know these are the digital veins from adjacent sides of the digits. We can find these digital veins forms the dorsal metatarsal veins. 1, 2, 3, 4 dorsal metatarsal veins unites to form a arch which is called dorsal venous arch. And within the arch we can and on the medial and lateral side we can also find the digital veins enters, and ultimately one is continued on the lateral side, one is continued on the medial side. The lateral side it is continued as small saphenous vein, and medial side it is continued as great saphenous vein. Okay. Now about the cutaneous nerves. In the lower part of the leg, there is one nerve we can find which is called superficial peroneal nerve, which is also called musculocutaneous nerve. We have seen the musculocutaneous nerve in the upper limb, which supplies the biceps, brachii and brachialis muscle. Similarly, here we can also find one cutaneous nerve which is called the superficial peroneal nerve, which not only supplies the skin, but before that it supplies the muscles. Which muscles? Lateral compartment muscle, that is peroneus longus and peroneus brevis. First it supplies the peroneus longus and brevis, then it pierces the deep fascia and becomes cutaneous, and it supplies lower 1/3 of the leg and major part of the dorsum of the foot. We can find this superficial peroneal nerve divides into medial and lateral components, which ultimately supplies the adjacent sides of the digits. We can see it divides into one medial and one lateral component, and ultimately it breaks and it supplies the adjacent sides, except the web space in between the great toe and the second toe. Except the web space of great toe and the second toe, rest of the cutaneous supply is by the superficial peroneal nerve, and this one is supplied, this area is being supplied by another nerve which is called deep peroneal nerve. Actually, the superficial peroneal nerve and deep peroneal nerve, they are coming from one nerve. So, gradually the digits will not get its blood supply. If the digits do not get the blood supply, what will happen? There will be necrosis of those digits, or gangrene and necrosis of the digits. It is found in low socio-economic condition and person with continuous smoking habit. So that is called Buerger's disease. The same thing in a diagrammatic way we can find nicely. This is the deep peroneal nerve and this is the anterior tibial artery and this is the extensor hallucis longus and this is the extensor digitorum longus and this is the peroneus tarsus. Now we can find this muscle which is taking origin from the medial surface of the tibia and which is going on the medial side, that is the tibialis anterior. This muscle is the extensor digitorum and in between we are getting the extensor hallucis and most laterally this is the peroneus tarsus. This is the origin and insertion of the tibialis anterior. Okay. Similarly, this is the origin of the extensor hallucis longus. Okay. You can see PhD H. Okay. Next, extensor digitorum longus, okay, from above, okay, you can see originates from the lateral condyle of the tibia, whole of the upper 1/4 of the extensor surface of the fibula. Similarly, the same thing. Now this is the peroneus tarsus from the lower part of the extensor surface of the fibula and it is attached at the base of the 5th metatarsal and peroneus tarsus is for eversion. Eversion, peroneus longus, brevis and peroneus tarsus, they are for the eversion. Now we can find here the arteries. The anterior tibial artery, we know there is a gap in upper part of the interosseous membrane from where it is coming and it is, we can find it in the extensor compartment and it is continued as arteria dorsalis pedis. From here we are getting one branch, that is the arcuate branch, and from the direct branch we can find the first dorsal metatarsal arteries and others are coming from the arcuate arteries and ultimately they supply the digits. So arteria dorsalis pedis, through its branches and sub branches it supplies the digits and also it supplies the metatarsal spaces, okay, and ankle and everywhere in the dorsum. Now I told you about this nerve coming from the common peroneal nerve which divides into superficial and deep. Superficial is for the lateral compartment of the peroneal compartment and deep is coming in the extensor compartment. It remains lateral. In the middle it tries to cross, again it goes to the lateral side as if it hesitates to cross this artery. Okay, this deep peroneal nerve, it remains lateral, then it is trying to cross the artery, then it is going lateral to it. Okay, and ultimately in the foot it will divide into two branches, one medial branch and the lateral branch. This is the picture of the anterior tibial artery. You can see it gives so many branches on the lateral side, on the medial side of the ankle. Okay, the lateral malleolar and medial malleolar branches. Okay, and tarsal branches, and ultimately from the arteria dorsalis predis, the arcuate artery and the first dorsal metatarsal artery, and it passes in between and it goes to the plantar aspect. Okay. Now we can see another muscle in a deeper plane, which is a local muscle, which is called the extensor digitorum brevis. Previously we have seen extensor hallucis longus and this is the extensor digitorum brevis, originating from the tarsals. Okay, tarsal bones, and it also divides into 4 tendons, and the first tendon is going to the great toe, and the second, third and fourth, they are connected with this tendon of the long tendons, that means the tendons of extensor digitorum longus on its lateral side. Okay, so the first one is going absolutely medially, the second, third and fourth, they are attached to the lateral side of the other tendons of or the long tendons. Okay, that means the tendons of extensor digitorum longus. Okay, in addition, nature has provided another muscle for extension and we can find this deep peroneal nerve divides into, we can find one is lateral one, okay, and one is medial one. Okay, and here we can find a pseudoganglia. I told you that you have seen a pseudoganglia in the median nerve. There are some pseudoganglia in different parts of the body. You can find one pseudoganglia you can find in the median nerve in hand. You can find a pseudoganglion in the axillary nerve, which supplies the teres minor muscle. Here we can find this pseudoganglia in the deep peroneal nerve. Okay, so deep peroneal nerve also supplies this extensor digitorum brevis, and ultimately this medial component it supplies this first and second wave space. Except the first and second wave space, all the wave spaces in the foot are supplied by superficial peroneal nerve. Here we can find common peroneal nerve divides into deep and superficial peroneal nerve. The superficial peroneal nerve, this is the superficial peroneal nerve and this is the deep peroneal nerve. So lower part of the leg and the most of the dorsum of the foot, it is supplied by the superficial, this pink color is showing the dermatome. What is dermatome? The area of the skin supplied by a particular cutaneous nerve is called dermatome. So here we can see the dermatome of the superficial peroneal nerve. So this is the area of the superficial peroneal nerve. Except this area, the blue area is supplied by the deep peroneal nerve. On the lateral side, this is by the sural nerve, and medial side by the saphenous nerve. This is the dermatome of saphenous nerve, sural nerve, superficial and deep peroneal nerves. Same thing, the same muscle we can see extensor hallucis, this extensor digitorum brevis, the first tendon is also called extensor hallucis brevis. Okay, extensor hallucis brevis, which is nothing but the first tendon of the extensor digitorum brevis, and rest of the tendons are, you can see, they are attached to the lateral side of the respective tendons. Okay, and dorsalis pedis pulse, very important. In Buerger's disease, if it is absent, okay, then we can appreciate that patient might be having some atherosclerotic changes, which is called Buerger's disease. Already I have mentioned. Thromboangiitis obliterans you will know in pathology. Okay, what is called thromboangiitis? Thrombo means thrombus. Angiitis, mane inflammation of the artery or vein. Okay. Angiology means the study of arteries or veins. Thromboangiitis and obliterans means gets obliterated, which is called Buerger's disease. You can also find Leo Buerger, Austrian and American surgeon, discovered that one. Brevis, and this is the origin of the peroneus longus. In upper part, on the lateral surface of the fibula, in its upper part from the peroneus longus, and from the lower and the middle part, this is the peroneus brevis. Longus is a long tendon and brevis is attached to the fifth metatarsal. So, this is the eversion. This is called the eversion of the foot. They are caused by peroneal group of muscle, peroneus longus, brevis and tarsus. You can see the course of this muscle, this course of the tendon, peroneus longus is attached to the medial cuneiform and on the lateral side of the base of the first metatarsal. They maintains the longitudinal and transverse arch of the foot. So there are two clinical entities. One is talipes varus and one is talipes valgus. Varus is due to inactivity of the lateral compartment muscle and valgus is overactive lateral compartment muscle, whereas the the anterior compartment muscles are not acting properly. You can find in your clinics talipes varus and valgus, or you have in your day-to-day life experience, you have seen this picture. Talipes, varus, and this is valgus. Varus is due to inactivity of the lateral compartment muscles, whereas the anterior compartment muscles which are overactive. In valgus, the anterior compartment muscles are weak and the peroneal compartment or lateral compartment muscles are overactive. This is the superficial peroneal nerve which supplies both the longus and brevis muscle. Peroneus longus and peroneus brevis muscle.